Hi everyone, welcome and thank you for joining us for today's ASA web seminar, Sensory Loss in Aging. This event is part of the Family Caregiver Support Series sponsored by Home Instead Senior Care. We'll be getting started shortly. The slides for today's presentation are available on the tab on your screen marked Resources, and under the tab marked CE Application here, you'll find information on how to obtain CE credit for this event. You'll have 60 days, to complete continuing education application for this event, and it may take 30 days from the date of your application in order for us to process and issue your CE credit. If you are not logged in directly to this web seminar, that is if you're watching as part of a group and did not log in using an individual confirmation URL, you will not be eligible for continuing education credit because we have no way to track your online attendance. If you'd like to receive CE credit, please be sure you log in using the confirmation URL you received after individually registering. If you have questions during the presentation, you can send those at any time using the questions box, and we'll save those for the last 15 minutes of today's program. Now I'd like to introduce Lakelyn Hogan. Lakelyn is a gerontologist and caregiver advocate for Home Instead Senior Care and a doctoral candidate at the University of Nebraska, Omaha, studying social gerontology. Welcome back, Lakelyn.
Thank you so much, Betsy. Hello, everyone. I'm so glad that you've taken time out of your day to join me. Today we'll be talking about sensory loss in aging. And while everyone ages differently, most people notice a decline in their senses or sensory perception as they grow older. Many chronic illnesses, even medications, can negatively affect one or more of the senses. And sensory loss can pose challenges for older adults as they age. While some senses can be improved with things like hearing aids and eyeglasses, others might require assistance. Sensory impairment can compromise a person's ability to perform common and simple tasks, such as hearing a whispered conversation or side remarks, writing notes, reading the newspaper, or even recognizing facial expressions. And as older adults experience sensory loss, they may need to rely more heavily upon family members and others for support and assistance with things like activities of daily living. So we're going to dive deeper into all 5 of the senses. But first I want to go over our objectives for today. So we'll start by reviewing the ways that aging impacts the 5 senses. Then we'll talk about factors that can impact sensory loss in each of the 5 senses. And I'll be discussing strategies for compensating for these sensory losses as we go throughout today's presentation. And then, of course, we'll end with some tips and resources to help individuals living with sensory loss and family caregivers best support their loved ones with sensory loss. So we all have grown up knowing the 5 senses, our sense of sight, smell, taste, hearing, and touch. And often, I don't know about you, but I take them for granted on a day-to-day basis. As we age, there's a slow progressive decline in our sensory symptoms. And so right now I'm going to touch briefly on all of the 5 senses, but then I'm going to dive deeper into each and offer some practical tips on how we can help those living with sensory loss in those various 5 areas. So first is, of course, our sense of sight. It's normal for people to notice changes in their vision as they age, such as finding it harder to focus their vision close up or needing more light to see well. But actual vision loss, however, is not a normal part of aging. But we do know that as we age, the risk of developing age-related eye conditions increases. So again, the loss of our sight is not a normal part of aging, but it can be more common as we get older. For our sense of smell or our olfactory abilities, they can also diminish with age. 18% of older adults have a significant impairment in their sense of smell, and 46%, almost half of those over the age of 80, have very limited ability in their sense of smell. So as you can imagine, this can impact a person's sense of taste because our sense of taste and smell are often so closely associated. And as we age, our taste buds change. They may start to shrink or become less sensitive. And typically, our taste buds are replaced every couple of weeks, but as we age, these cells begin to lose their sensitivity and ability to regenerate. And I would like to note that the changes in our taste and smell that are related to age are usually gradual over time. A sudden loss of taste or smell, especially in today's day and age where we're experiencing a pandemic, that's needing immediate medical attention because it could be a symptom of COVID-19 or coronavirus. So again, when we talk about smell and taste with aging, it's usually gradual. So if an older adult loses their sense of smell or taste immediately, it's cause for medical attention. So next we have our sense of hearing. We know age-related hearing loss is common, but with about 2/3 of those over 70 having compromised hearing. But we do know that there are things that we can do to help enhance a person's ability to hear, like hearing aids. There may even be an option for a cochlear implant. But hearing loss can be detrimental to a person's health, and we'll talk more about that later. And touch. With the final of the 5 senses. As we age, our sense of touch often declines due to skin changes and reduced circulation. We might become less sensitive to temperatures such as hot and cold, and small motor skills such as opening a jar or handling silverware might become more challenging. So again, I'm going to dive deeper into each of these 5 senses in just a moment, but when we talk about sensory loss, there are some important kind of overarching considerations that we need to take into account. Some older adults will experience sensory loss in multiple senses. So that's considered dual sensory loss if there's 2 or more. So dual sensory loss is a significant factor affecting the quality of life and cognitive function of older adults. An example of this would be a combination of vision and hearing loss. If you think about your own daily life, if you had decreased vision and decreased hearing abilities, how would that impact everything that you do throughout your day? However, if an older adult experiences loss in one sensory modality, it doesn't necessarily mean they'll have loss in other areas. So they can have loss in multiple or, of course, one. A person who is experiencing loss or impairment in one or multiple of these senses, it could impact their ability to manage chronic conditions. So that's something we need to think about as we're working with older adults. For example, if an individual has an impact in their sense of touch, that could make the management of diabetes, for example, more complicated, especially if they have to test their own blood sugar and inject their own insulin. If they have issues with sensitivity, neuropathy in their fingers, or minimal dexterity, the ability to use their hands, that could make management of their diabetes more complicated. They might need assistance. Sensory loss could also limit a person's ability to participate in their own activities of daily living. For example, vision loss could make the morning routine more complicated, could take the individual longer to get ready for the day. And it could also sensory loss could also impact a person's ability to socialize. Hearing loss, for example, could prevent the individual from engaging in conversation, or vision loss could prevent them from being able to drive themselves to social activities that they're used to participating in. So again, these are important things to think about. How is it impacting their day-to-day life, their ability to socialize? And it also could be impacting their cognitive function. There is a sensory deprivation hypothesis that states that a lack of adequate sensory input could result in cognitive degeneration over time. So it's really important that we encourage older adults to stimulate their senses and, more importantly, address any concerns that they have with their medical providers. And we'll talk more about these various considerations as we go through each of the 5 senses in more detail. So we're going to start with vision loss. So as I mentioned earlier, changes in vision are normal with aging, but vision loss is not. So an older adult might start out just kind of needing my mom calls them cheaters, or some people call them readers, as they read. They might just have some issue reading close up, but if they start to experience vision loss, then it's really important that they meet with their medical provider. And it's really important for older adults to have their vision checked regularly. We know, again, that as a person increases in age, the risk for age-related eye diseases becomes more common. So of the age-related eye diseases, I've listed the most common on the screen, and many of the older adults you work with may be experiencing these various diseases. So glaucoma occurs when the pressure in the eye is elevated, which can damage the optic nerve and result in vision loss and even blindness. And a person with glaucoma may notice their side or peripheral visions gradually fading, kind of creating a tunnel vision effect. Cataracts results in the clouding of the eyes, usually that transparent lens. And you'll hear a lot of people having cataract surgery to remove that. The technology is very advanced. It's pretty amazing. I know both my grandparents have had various cataracts removed over their lifetime. Macular degeneration diminishes sight in a significant way. It affects one's central vision. In the earlier stages of macular degeneration, there may not be as many symptoms, but as a person progresses, and if it's not treated and if the individual is not staying on top of things, a person's central vision can eventually appear wavy and blurry, and in very advanced cases, their sight may diminish completely in certain aspects. And then diabetic retinopathy is a potentially blinding disorder that can result as a complication of diabetes. So there can be damage to the eye if diabetes is not managed properly. And this could create dark shadows or objects that appear to float in the vision. Again, it's really important for older adults, if they're experiencing any vision issues, that they're addressed with their medical provider. A loss of sight can be potentially devastating and really can impact a person's quality of life, their independence, and even their mobility. And a lot of times people associate their sense of sight with mobility, but it makes a lot of sense. If you can't see where you're going, or if your vision is blurred, you might be more likely to have a fall or a trip or to bump into something. And vision loss has been linked to falls and injuries and worsening health and cognitive conditions, social function. It's even impacted some people's employment and educational attainment if they've suffered from vision issues throughout their lifetime. And visual impairment can significantly reduce the participation in activities of daily living or in social activities that they, again, were used to participating in. And we know how important it is to stay socially engaged as we age. So I wanted to provide some practical tips for each of these 5 senses, because when I'm working with the older adult population and with family caregivers, it's one thing to educate them about it, but it's another thing to offer some practical tips. So of course, first and foremost, we want to have older adults regularly scheduling eye exams. Even if they're just using those cheaters or readers, it's important to have a baseline so that if there is a vision change that's more substantial than just needing those readers that you can buy at your local drugstore, that there's a baseline to compare that to. It's also important to ensure that glasses and contacts have the most current prescriptions. That's really important for functioning in daily life. Many older adults often opt to have surgery, as I mentioned, to remove those cataracts, and there may be other surgeries for the various eye-related diseases. It's also important to pay close attention to contrast. For example, avoid placing light foods such as mashed potatoes and chicken on a white plate. That might be a helpful tip for a caregiver, because if you do that, the older adult might not be able to see as easily as if you were to place it on a red plate or a green plate. Also, if you have, for instance, a light switch with a white switch in a white covering, the individual might not be able to really see that that light switch. So even just switching out the light plate for a darker color could really help a person maintain independence and increase their safety. Sometimes it's those little things that we don't think about. Also, make sure the areas of the home that are used frequently have adequate lighting. Simple things like night lights or those push light buttons or ones that are motion censored can really help older adults see better in the dark and create a more safe environment. Reducing glare indoors with window coverings or window films can be helpful, and also just wearing sunglasses outdoors can also go a long way in helping to reduce glare. Large print can be helpful when possible, using a magnifying glass to read, or a lot of websites have an option for increasing the font size, or on an e-reader like a Kindle, you can increase the font size so your loved one or the individual can continue to read books if that's something that they really enjoy doing. You can also ask for large print on things like medication bottles. It's always, you can always ask for those types of things. And again, those electronic products can help to increase the size. There's also a lot of great audio products like audiobooks or telephones that have an audio feature. And you can also seek out a clinic or center that specializes in low vision. I know in my community at our university hospital, they have a low vision center, low vision clinic, and I visited there several times. The photo you see on the screen is part of the clinic. They have a lot of products for people who are faced with low vision issues. And I'm really blown away by all the great resources that they have. And they have a kitchen with various examples of how you can increase independence in that room of the home, and I'm going to share some of those examples with you later on. You can also highlight the edges of objects to help a person see that object. For example, putting a piece of colored duct tape on the edge of a coffee table, or painting outside on your outdoor stairs the edge of the stair so that the individual can tell where that stair ends and the next stair begins. Again, sometimes it's these really simple things and practical tips that we can offer up that can go a long way in helping someone maintain independence. So next we'll move on to smell. Some loss of sensitivity to smell is normal with aging, and that term is on the screen there for you. Pardon me. And as we age, there tends to be a decline in our ability to detect and identify odors, which can be a concern for the older population. It can be a concern in the area of various risks. So our sense of smell can alert us to a fire before we even see the flames. It can also make us kind of recoil, or if you've ever taken something out of the fridge that's rotten and you go to smell it and you just automatically jerk back, that helps us realize that that is a risk. Eating that food will make us sick, but if you've lost your sense of smell, you might not be able to recognize that. It also provides us with the ability to detect and avoid many poisonous and dangerous gases like natural gas, and it can also make us aware of our own personal hygiene. And for some older adults, that could be a sign that they are having issues with their sense of smell. They might not recognize that they might need to take a shower or a bath. And it can also, a loss in our sense of smell can also impact our nutritional intake, because as I mentioned earlier, your sense of smell and taste are so closely connected. And there are certain factors that can impact our sense of smell, such as smoking, different medications, a stuffy nose, as you can imagine, due to the flu or cold. Certain treatments, such as chemo or radiation, can also impact a person's sense of smell long-term or for a temporary period of time. And then also things like seasonal allergies. So what are some practical tips that we can offer families and older adults as it relates to their sense of smell? Well, first, notify a healthcare provider about drastic changes in sense of smell, because as I mentioned earlier, it could be a sign of something else that's going on. Right now, during this pandemic, it could be a sign that the person has COVID or coronavirus, and that they need to get tested. I have a friend who recently had COVID, and she said that she put the most strongest smelling Bath and Body Works candle she owned up to her mouth or her nose and took a whiff and smelled nothing. So again, that could be a sign that it could be related to COVID-19. Installing smoke detectors and carbon monoxide detectors are very important. I think that's important no matter if you have lost your sense of smell or not. And some local fire departments can install a smoke detector if a senior is not able to do so. The Red Cross, I believe, also has a program for that. Also, consider adaptations, maybe changing to an electric stove versus a gas stove if a person has issues with their sense of smell. Also, checking used by dates on food and cleaning out the refrigerator regularly can help reduce the risk of not being able to smell those rotten or spoiled foods. And making a routine for personal hygiene can be important, or getting assistance in that area if it's needed. Also, studies have shown that you can possibly regain your sense of smell by being curious and trying new smells. So if you expose yourself to fragrances several times a day, such as eucalyptus, flowery scents like roses, you can truly stop to smell the roses a couple times a day. Smelling fruity smells like lemon or aromatic smells like clove. So really stopping and smelling can in some cases help you to regain a little bit of that sense of smell. And we all know, again, that smell is so closely associated with our sense of taste. So using more seasonings on our food can help make it might be able to help us smell it better. So things like lemon juice or spices can be a great way to do that. So we'll talk about taste next. As I mentioned earlier, our taste buds lose sensitivity and the ability to regenerate as we age. And this is significant for older adults because oftentimes as a person gets older, we'll see them starting to use more sugar, salt, fats on their food to make it taste better. I've noticed this with my own grandfather. He has lost some of his sense of taste and smell over time, and he started to add some extra salt and sugar to things. And my grandma's a little offended by this because she's an amazing cook. So when it first started, she was kind of upset that he was over-salting the food she was making. But then they started to realize that he was starting to lose some of his sense of smell and taste. And of course, they've addressed that with his healthcare provider. But a diminished sense of taste could also be due to some of the factors that are similar to the sense of smell. So things like nasal and sinus issues, medication side effects, and these side effects could also decrease a person's appetite, so they might not be eating as often. Dental issues, I think a lot of times when we think about eating and our sense of taste, we might not think about dental issues, but if a person has ill-fitting dentures or if there's issues in the mouth that are occurring, it might prevent them from being able to taste or enjoy a meal. So it's important to have those dental issues addressed and to have regular dental appointments. Medical treatments, as I mentioned earlier, like chemo and radiation, and smoking can impact also our sense of taste. And a loss of taste could lead to a reduction in appetite, as I mentioned. It could also lead to weight loss. If you're not able to taste the food that you're eating, you might not be as motivated to eat healthy or to eat regularly. So it might cause some weight loss. It could also lead to poor nutrition. As I mentioned earlier, the salty, sweet, fatty foods, those might be the taste that a person can still maintain into those older years. And so they might lean towards those foods, which for some health conditions might not be in line with the doctor's orders. And it could also cause a weakened immunity if a person's not getting the proper nutrition. And these are all important things to consider because if an older adult's not getting proper nutrition, regular meals, due to their decreased sense of taste, they could become more lethargic, they could lose muscle mass, they could start to experience dizziness and lightheadedness, which could turn into safety concerns that lead to falls and injuries. So a loss of taste could have more detrimental effects than just missing a meal or maybe not eating as much as they used to. It could lead to some other issues. And of course, if an individual can't taste spoiled food, that could also lead to potential food poisoning. So what are some tips for our sense of taste? Well, of course, notify the healthcare provider about a drastic change in a person's sense of taste. I would also add to that regular dentist appointments, which I do have there on the screen because it could be impacting the person's ability for proper nutrition. Understanding those medication side effects and reporting changes in taste to a healthcare provider if that is a side effect that's occurring soon after an older adult starts taking a medication. Also using a variety of seasonings and flavorings, but being mindful not to over-salt or over-sugar a meal. I could try new spices or flavors to try to entice a person to try new foods and to eat something new and different. And no one really enjoys eating alone, especially if they cannot taste foods as well as they used to. So making mealtime an experience, enjoying meals with others can be a good way to motivate an individual to engage in mealtime. And I know right now with social distancing, that might be a challenge for some families, but maybe enjoying a meal outside together or setting up a Zoom call at dinner time to talk while you're eating could be a great way to encourage mealtime. And then also avoiding known allergens and triggers, of course, is important. So next we're going to be talking about hearing loss. So hearing-related or age-related hearing loss gradually occurs with aging, and there are other factors that can contribute to hearing loss, including noise-induced hearing loss, which could be caused by long-term exposure to sounds that are either too loud or that last too long. You might think about individuals who work in professions where they're around a lot of noises for extended periods of time. That could be a contributing factor. Conditions that are more likely in older adults, such as high blood pressure or diabetes, that could also contribute to hearing loss. Medications that are toxic to sensory cells in your ears, for example, chemotherapy drugs, could also cause hearing loss. And on more rare occasions, hearing loss can be caused by abnormalities in the outer ear and the middle ear. So, again, hearing loss can occur because of age-related changes, but it could also be induced by other reasons. Approximately 2/3 of older adults over the age of 70 have meaningful hearing loss that affects daily communication. And that's a pretty significant number. And I know that I've worked with so many older adults over the years that have issues with hearing loss. And oftentimes there is hearing aids and other ways that they have other strategies that they've used to help them in their daily life. And I'll be sharing some more of those tips here in just a moment. Hearing loss can also have a significant impact on a person's life and can make it hard to understand and follow doctors' advice. It can make it difficult to hear the phone ringing or the doorbell ring. Hearing loss might also prevent an older adult from hearing or responding to warnings, such as smoke alarms, and can also cause an individual to miss out on socializing with friends because they cannot hear the conversation, or they might start to withdraw from social activities because they don't want to be embarrassed by the fact that they cannot hear, that they're miscommunicating. So sometimes you'll see an older adult withdrawing from socialization. And I noticed this with my own grandma. At big family gatherings, sometimes she disengages from the conversation if she can't hear well, or if we ask her a question that's not a yes or no question, she might answer with yes or no, or she might just kind of laugh because I then realized, oh, she can't really hear what we're saying. So now at family gatherings, we make sure that she's at one end of the table so that she's not hearing conversation coming from both sides of the table, and we are making more of an effort to speak directly to her, making sure we're making eye contact So she knows that we're talking to her and speaking loud enough so that she can hear. She also wears a hearing aid, and that has also made a big difference. Because our overall sense of hearing is so important for daily functioning, when a person is experiencing hearing loss or has impaired hearing, it can result in things like decreased well-being, lower mood, again, that social isolation, poor physical functioning, and cognitive issues. And I know right now with COVID-19 and coronavirus, a lot of people are unable to visit a loved one in a care community, and really the telephone is all they have to communicate. And sometimes if the individual has hearing loss, it really can cause challenges for trying to communicate and socialize. So families have gotten creative using FaceTime so that the person can see our mouth move. I don't know about you, but if you've ever been talking to somebody and they just happen to put their hand over their mouth, I sometimes can't understand what they're saying because I rely so heavily on watching their mouth move as much as I do hearing their words. So, trying to communicate over the phone for someone with hearing loss might be an added challenge. And I know that the topic of hearing loss is sometimes touchy when we talk with older adults. Older adults don't often want to admit that they have issues with hearing loss. And for some reason, hearing aids still have such a stigma, even though they're making hearing aids, I think, less noticeable. They're making it a little more discreet. But if families are having challenges or just wanting a little more kind of guidance in how to bring up this conversation, I found this great hearing evaluation. So it's really important to have our hearing evaluated regularly by a medical professional, but there's also a simple tool that can be helpful for self-evaluation or helpful to family caregivers. So as an older adult completes this questionnaire, maybe the family caregiver can kind of go through the checklist in their head or talk to their loved one about it. If they answer three or more times to these questions, they could have a problem with hearing and need to get hearing checked by a medical professional. So again, I like this because it asks questions about social situations and communication and the impacts that their hearing loss has on them. Questions about limitations due to their hearing loss. So it could just be, I know there's probably a lot of hearing evaluations out there, but I found this one to be quick and easy, so feel free to use it. And oftentimes I hear the topic of dementia brought up a lot in terms of conversations on hearing loss. So I did want to talk about that today. I seem to think that this conversation can be compared to the age-old question of which came first, the chicken or the egg, because so many people wonder, does dementia cause hearing loss or does hearing loss cause dementia? And research has found evidence that really supports both ways. So hearing loss really causes the brain to have to work harder and impacts the cognitive load. And cognitive load involves the process of making an effort to listen, processing that information, remembering the information, and then responding. And so hearing loss can make it harder to go through that process. And those with hearing loss, they might exhibit similar symptoms of dementia because they cannot hear, or they might not be able to separate speech from background noise. As I mentioned the example of my grandma at a large family function. She might not be able to separate what I'm saying from the rest of the noise that's going on. And so in those types of situations, a person might withdraw from the conversation, or they may ask someone to repeat the question, or they themselves might repeat a question over and over, simply because they cannot hear. And some of those symptoms might be misinterpreted for dementia, but really it's because of hearing loss. So with a hearing aid, or in some cases a cochlear implant or cochlear surgery, they can regain some of that sense of hearing. And so often, again, sometimes people confuse hearing loss for dementia. But hearing loss could lead to changes in brain brain structure and function over time. There was a longitudinal study that was done by Lynn and colleagues over a 6-year period of time where they compared the brain volume of older adults with hearing impairment to those without hearing impairment. And what they found was that those with hearing loss had an accelerated loss in brain tissue over time. So these brain structure changes could impact a person's cognition. But we also know that cognitive impairment, if someone has dementia or has Alzheimer's disease, it could contribute to hearing-related difficulties and challenges with listening. So the degeneration of the brain due to the dementia could impact the person's ability to do a variety of things, and one of which might be their ability to hear and communicate with others. So someone living with dementia, they might need more time to process what they hear, form a response, and answer. And oftentimes, I see family caregivers, they jump in quickly to respond for them if the individual is not answering. But what I found often is if you're talking to someone living with dementia, if you just ask them a question or say something and pause for 7 to 10 seconds, it may feel like eternity to you, but to that person, it gives them time to process what you said, form a response, and to repeat it outward to you. So again, sometimes if someone's living with dementia, they might be, it might just take them a little extra effort to communicate. It might just take a little extra patience for those that are communicating with them. But whether a person has hearing loss or has dementia, both can interfere with their interaction with others and could lead to social isolation and loneliness. So we want to be sure that we are addressing hearing loss concerns. But the good news is hearing loss can be modified to reduce the risk of cognitive impairment. And hearing aids and cochlear implants can help to improve hearing and, again, reduce the risk of dementia. So this is an important modifiable factor. And I think that, again, sometimes hearing aids get a bad rap, but we really need to reduce the stigma that is associated with them because they can make such a difference. So some practical tips for hearing loss: of course, getting hearing checked regularly, the use of hearing devices, hearing aids, and you do find that in general, hearing aid use is low. And sometimes people are quick to blame the cost of the hearing aid, which is certainly a barrier for some folks. But research has found even when the cost is eliminated, usage can still be low. So again, I think it points to kind of the stigma associated with hearing aids. Having to admit that you need a hearing aid can be really hard for some individuals. Some other tips, ask the person to face you and to speak more slowly and clearly. You might ask them to speak louder, but not shouting. You also want to pay attention to what is being said. And also you can use some facial expressions and gestures to also help you communicate your point. Because as I mentioned earlier, using if you're hearing impaired, being able to see gestures or see the person's mouth as they talk can really help in comprehending what is being communicated. And then if the person you're talking to, if you don't understand them or you want to seek more clarity, simply ask, just so that you are on the same page. And then find a good location to listen. Sometimes it's important to maybe go into a different room of the house at a family gathering and have a more one-on-one conversation. Or if someone picks a loud restaurant for lunch, you might ask for a corner booth. Or if you know in advance, I know my grandma has a couple restaurants in town she hates to go to because it's so loud. And I actually am finding myself avoiding those types of restaurants when it's really loud and echoey, because I really enjoy that one-on-one time with whoever I'm dining with. So just a few quick tips in that area. And then the final sense is our sense of touch. As we age, I mentioned earlier, our sense of touch can decline due to various reasons. Skin changes, reduced circulation, loss of sensation that could be caused by a complication of diabetes. It's called diabetic neuropathy, and this is occurs when there is nerve damage. Other conditions that may cause a loss of feeling are a stroke, a spinal cord injury, sometimes tumors or infections also can impact our sense of touch. And these changes could impact daily functioning for older adults, including changes in their mobility and balance. If you're losing feeling in your feet and your toes, it could lead to unsteady balance, which could lead to a trip. A loss of feeling in your fingers could result in not grabbing onto an item tight enough. Think about, a grab bar. That can be an important thing to be able to grab onto. It's also important to consider the impact on a person's sensitivity to pain. If they're less sensitive because of changes in their sense of touch, it could result in an older adult not realizing that they have a bruise or a cut or a skin tear. It could also lead to an ability, a lack of ability to sense hot and cold. So it's important to pay attention to water temperature and room temperature. And I think it's also important to note the power of the human touch, especially in a time where so many older adults are experiencing touch starvation and touch deprivation due to COVID-19. A lot of people are having to social distance. They're not able to see their loved ones in communities. And this touch starvation increases stress and depression and anxiety. And it can trigger a cascade of negative physiological effects as well. And so I think it's important right now that we find creative ways to still engage in the human touch, maybe while maintaining social distance or in a safe way. And when it comes to social situations, the primary purpose of touch is to form trust and cooperation, to show love and convey affection. So research points to the impact that touch can have. So some quick tips on our sense of touch. Try to avoid injury, those cuts and burns, and treat them properly. Of course, covering our hands with oven mitts when we're cooking and using the stove. Check or have a family member or caregiver check the tops and bottoms of our feet and our heels in between our toes to look for hot spots, blisters, sores, changes in skin color or cracks that could impact our balance and the health of our feet, which get us so many places. Also, keeping skin clean and moisturized regularly. And also, touch from others can be good, as I talked about. It can lower blood pressure. It can lower the heart rate. So hugs when appropriate, hand holding, some gentle massage, and even pet therapy can be very, very impactful. I know I've mentioned sensory loss and dementia in the area of hearing, but the deterioration caused by the brain, the deterioration to the brain caused by dementia can also impact our other senses as well. So it's important for working with individuals living with dementia to consider these other areas. So our sense of sight, dementia can cause issues with depth, perception, and contrast. So I mentioned earlier the example of the white plate with the mashed potatoes and the chicken. The individual might not be able to see that as well as if you put it on a red plate. But they might not also be able to see the edge of a stair or the edge of a chair. If they're in a bathroom with a white toilet, a white wall, and a white floor, they might not be able to detect where the toilet seat starts and ends or if the lid is up or down. So you might consider changing out the toilet lid seat for a different color, maybe a black toilet seat, or painting the wall behind the toilet to make that contrast more obvious for the individual. They may also be more sensitive to glares and shadows that might cause visual misrepresentations. They might interpret a shadow to be a stranger or an animal, and they might also forget to wear their eyewear more regularly without reminders. Our sense of hearing, we touched on this earlier. They might not know what a word means, so using visual clues can be helpful. They might have trouble with interpretation. So if you're asking them if they want a snack, an apple or a banana, it might be helpful to pick up the apple and pick up the banana while you say it to provide a visual clue. They might also have auditory hallucinations, such as mistaking the phone ringing for a dog barking. They may also have some behavioral dementia-related behaviors due to overstimulation, a lot of noise, might make them anxious, or might make them cause to get up and wander or pace in the environment. But at the same time, hearing, our sense of hearing can be really enjoyable to those living with dementia. Music is something that can be enjoyed, well, by us all, but for individuals living with dementia, music can be a great way to engage in activity or to soothe or calm an individual. For a sense of touch, people living with dementia might have sensitivity to temperature. They might get cold easily. They might not be able to communicate if something is too hot or too cold, whether it be food or the bath temperature. And I found over time that ensuring the right warm environment before bathing or showering can really go a long way in making that activity more successful. So ensuring that the room is warm, that the water is the right temperature, that they have a cozy bathrobe to wear right before they get into the shower or bath can really go a long way, again, in making that event successful. And therapeutic touch can also be soothing for an individual living with dementia, whether it's holding their hand, rubbing their back, or utilizing, again, pet therapy. And finally, the sense of taste and smell. A person living with dementia might be slow to detect spoiled foods or forget to throw them away. Cooking may become more of a challenge. They might leave meals on the stove unattended, and if they have a diminished sense of smell, they might not be able to smell that it is burning. A person might also need reminders at mealtime or might need assistance with eating. But smells can be particularly soothing and comforting for those living with dementia. A lavender essential oil diffused in the air might be a sense of calm. Or if the individual loved to garden, a rose-scented candle might be really enjoyable to that person. So while a person living with dementia might lose their senses in these various areas or lose their ability to communicate, there's still great ways that people that are caring for those living with dementia, care partners, can use the senses to engage in enjoyable activities. Real quickly, I've mentioned medication throughout the presentation, but it can lead to some side effects that could impact the senses. So it's important to reconcile medications regularly, ask for those large print labels so that meds can be taken properly. Considering a medication management system, a great one I like is Simple Meds, but it can help with that medication management and also with the reconciliation, making sure that medications aren't negatively interacting, causing side effects that could impact the senses. Being aware of new side effects after starting a new medication and reporting those side effects and health concerns to a doctor, especially blurred vision, that can result for some people as a side effect of medication. And before I get to resources, I do want to offer up some additional tips for daily living. So I'm a visual person, and I love pictures of items. So I put those on the screen there for you to see because there are some great tools that exist that can really help enhance the independence of those that are living with sensory impairment. So in the kitchen, foam handles for those that have issues with touch. There's adaptive cutting boards and tools for those that have vision impairment. The last thing we want to do is accidentally chop our finger instead of what we are intending to chop when we're making a meal. You can use things like crock pots for easy meal preparation. One of my favorites for vision loss is using bump dots for the microwave and stove. So if you can see in the bottom right picture of your screen, the microwave, those orange dots are just little foam bumps that you can buy these sheets of them, and you can place them maybe on the 30-second or the start and stop button. And so the person with visual impairment would know that those are the buttons, and it can really, again, help to enhance their independence. Contrasting dishes and placemats, again, can be helpful for those with vision impairment, and adding light to food prep stations, whether it's under the cabinets, you can buy lights that stick up under there, or just, a desktop light. You could put it on the kitchen counter and turn it on when you're cooking. Some additional tips for the bathroom and dressing and grooming include things like grab bars, toilet seat risers, automatic dispensers for pumps for grooming, Contrasting colors, as I mentioned earlier, the toilet seat, floor, and walls. If you can have some contrast there, it can be helpful, especially for those with vision loss or those living with dementia. For dressing and grooming, adaptive grooming products, button hooks, Velcro to replace buttons, sock aid, and long-handled shoe horns. Those can all be helpful. I know that we're not talking about arthritis necessarily, but if you Google or on Amazon type in arthritis-friendly products, you'll find so many adaptive tools for daily living that can be very, very helpful for people with and without arthritis. And then there's just some tips for the general household and for medication management. So I mentioned earlier contrast on light switches and outlet covers. You can see that picture there. Makes a significant difference. Securing or removing rugs, adding additional light in dark areas, and there's even things you can do to adapt recreational tools like gardening tools and so forth. For medication management, using an upside-down cap for those that have trouble opening pill bottles or using a pill popper to get them out, or again, a product like Simple Meds that organizes the medication for you. And on the bottom right here, I have an example of painting the bottom edge of the step so that an individual can see where the step starts and ends. And again, that can be very, very helpful. And then also there's ways that we can all, at any age, work to save our senses as we go into our older years. So first, it's important to find a doctor and specialist that you trust, whether it's your vision, your hearing. Again, it's important to keep up with those regular visits. Also know your family history. Aging eye diseases might run in families, so knowing that history can help you communicate that to your healthcare provider and keep an eye on those various conditions and to learn about the symptoms. Also, eating healthy is always great, no matter what topic we're discussing, but it really can go a long way in the aging process and helping us all age more successfully. Stopping smoking and other hazardous habits can also help in preserving our senses as we age. Celebrating the sun safely with sunglasses and sunblock to protect our skin. Turning down the volume or taking a break from loud noises, or even, we all wear a lot of earbuds and ear pods, making sure that the volume's not too loud, or we take those out for, stretches of time and that we're not always plugged in. Keep moving. Exercise is great for the body and the aging process in so many ways, including helping to maintain our senses, minimizing and managing our stress, protecting our head and our sinuses, and then also getting help when you need it. We know that we talked a lot about how sensory limitations or sensory loss can impact a person's ability to engage in activities of daily living. And sometimes we just need a little extra help to maintain their independence. And so we need to encourage that it's okay to ask for help when needed. So I'm going to run through some resources now. Home Instead had created about a year ago, or earlier this year, it was an Aging Senses public education campaign. And if you visit agingsenses.com, what I love about it is there's a lot of interactive activities that you can engage in to better understand what it's like to live with sensory loss. There is a cookie baking simulator that helps you better understand what it's like to live with low vision. And there's also a lot of DIY activities that can help simulate sensory loss and help you it's kind of an empathy activity to help you understand what an older adult might go through as they lose some of their abilities in those sensory areas. And we have our professional caregivers at Home Instead go through some of those activities, again, to provide that empathy and that perspective for those that we work with. So some final resources here for you. Agingsenses.com, of course. The local area agency on aging is a great place to go if someone needs help and support. The Hearing Loss Association of America, American Federation for the Blind and Low Vision, their websites are there. certified resource professionals. You can find more information at their website. Occupational therapists are also a great resource for those that have sensory loss in any of the 5 areas. They can often work with the individual to enhance their independence as they work in their kitchen or in their bathrooms or as they engage in their daily routines. Of course, you can always hire in-home support and care to help an individual with sensory loss. One of the ladies that I've worked with over the years, she hired a professional caregiver. She had low vision because she wanted to still maintain independence in the kitchen area, but she needed someone to chop all of her vegetables and her fruits and get everything ready for her and kind of help with her meal preparation. So that was one of the, I'll never forget, she's the one that introduced me to our low vision clinic in my community, and she had those foam buttons on her microwave. And so I learned a lot from her in the time that we worked together. Also, general caregiving resources can be found at caregiverstress.com. And then that medication management solution I mentioned, the website is there as well. So I really appreciate all of you tuning in today to learn more about how aging impacts our senses. We all use our 5 senses each and every day. And if you find yourself experiencing any changes in those senses, or if the older adults you're working with experience changes in those 5 senses, it's important that they seek medical attention. And again, as professionals, we can share tools and resources with caregivers and older adults to hopefully help them remain independent despite those challenges they might be having with the various senses. So with that, I will open it up for any questions that people might have.
Thanks so much, Lakelyn. There's been a few questions that have come in. One of them was if you know of a store where folks can shop for some of those adaptive tools that you shared.
Yeah, so I would say if you have a low vision clinic, which I know not every community has, I feel like our community is very lucky. The clinic might have some of those tools and resources that you can go to the clinic and purchase. Some of those are things you can buy at like a Walgreens or a CVS, or if you can online shop, Amazon has just about everything you could ever want and wish for. So I would start with those places to look for those tools. And sometimes you just have to get a little creative. But the things like the outlet covers or the light switch covers, you can get those at any local hardware store, or you could even take it off the wall and spray paint it. You don't have to go out and buy a new one. So or you can cut out a piece of paper and tape it to the outlet switch. So you can get really creative with some of these things. If you're going to paint the edge of the staircase, good old spray paint or duct tape is a great place to start. But that's a good question.
I know you talked a bit about the hesitance of people to use hearing aids, and someone has asked if you have any suggestions for how to work through that with individuals. This is particularly maybe someone who has dementia as well.
Yeah, and I think especially if someone's living with dementia and they have hearing loss and you're trying to get them to wear hearing aids, that can be a challenge because they might not know, what the hearing aid is for. And so, every situation is so different. And so I wish I could ask, some more clarifying questions. But when you think about it, for an individual living with dementia, if they're constantly taking out those hearing aids and it's becoming an issue, it might be time to kind of evaluate, are those hearing aids really needed? Are there other things we could do, like making sure we're maintaining eye contact and making sure that we're on the same level as the individual so we're able to be face-to-face when we're communicating? Can I use visual cues, pointing or using an object, or if you're asking them if they are thirsty to do the motion of taking a drink, that might be a way to approach that situation. If you're looking to talk to somebody about hearing aids, I think, again, that checklist, you might, or that little evaluation that I had on the screen, you might not have to go through that and print it out and check each box. But you can use some of those questions as conversation starters. And I think a lot of times the fear of losing independence or having to admit that there's an issue often can be what is preventing the person from engaging in a solution that might actually help them. So sometimes if it's available, maybe offering to try it for a few days and see how it goes, see how it makes a difference. Also asking, what are your goals? And if their goals are to live independently and to be able to socialize with friends, just reinforcing that, this hearing device is going to enhance that and help you work towards that goal. So those are just a couple of suggestions, and I hope that is helpful. But I'm sure at these resources that I had back on this slide, if you the Hearing Loss Association of America, I would imagine that they also have some great tools and resources. So I would also encourage you to check out that website. Thank you for that question.
Great, thank you so much, Lakelyn. We have a few other questions. I'll forward these on. I think a lot of them were asked, and then you answered in the presentation. So it was such a great presentation, and thank you again for being here with us today.
Well, thank you so much, Betsy, and everyone. Thank you so much for tuning in, and I hope you have a wonderful rest of your day and a nice holiday weekend.
If you'd like to claim CEUs for today's web seminar, you'll receive a follow-up email by the end of the business day that will contain a link to the CEU application. That email will also contain a link to download today's slides. You'll have 60 days to claim CEUs for this event, and it may take 30 days from the date of your submission in order for us to process and issue your CE credit. The next presentation in this Family Caregiver Support Series will cover fall prevention, and that is scheduled for Wednesday, October 7th. You can visit our website at www.asaging.org for more information and to register for that event. Thank you, everyone, for joining us today. Have a great rest of your day.